Hi, my name is Isabel Call, and this is my ID. Today is March 11th, 2020, and I'm going to be videoing my head-to-toe assessment. And this is Alexis. Are you a willing participant for this video?
Yes.
Okay. I'm going to go ahead and do a sweep of the room. I do have my blank sheet of paper right here. I have my gloves, otoscope, all of the nice things that I'm gonna use. Nobody else is around. There. Okay. Okay. Can get a good angle here. Okay, now I'm gonna dump the information that I'd like to keep. Okay, so I'll start by introducing myself. Again, my name is Isabel. I'm going to be doing a head-to-toe assessment on you today. It's very nice to meet you.
Nice to meet you.
And what is your name?
Alexis.
Alexis. Okay, and how old are you?
22.
22 years old. Okay, and do you know what year it is?
2020.
2020. Okay, and do you know who was our president?
Trump.
Trump. Okay, and can you tell me where you're at?
The clinic.
The clinic. Okay. Can you tell me what you're doing here today?
Getting in a physical assessment.
Okay, and how do you feel today?
I feel fine.
You feel fine? Okay. So just from talking to the patient, she's alert and she's oriented. Person, place, time, situation. She's comfortable talking to me. We maintain good eye contact whenever she talks to me. She's willing to answer the questions as I ask. Now I'm gonna go ahead and wash my hands, okay? And then I'm gonna get started with the rest of your head-to-toe assessment, okay? What I also notice is that the patient is well-groomed. Her posture is good, and she doesn't appear to be in any type of distress, okay? So I'm gonna start with your hair. Okay, I'm gonna inspect your hair. And I note that your hair is brown, it's smooth. I don't see any type of hair loss anywhere. Normal hair distribution, no type of infestations. I don't see any lesions in her scalp. A little bit of dryness, but nothing out of the ordinary. Okay, perfect. And from here, I'm gonna look at your skin. Okay, so I'm gonna touch. All right, your skin. Now she's warm to touch. Her skin is normal color for her ethnicity. I'm gonna look for any type of lesions, type of skin breakdown, anything that's concerning. I'm gonna go ahead and look at your legs too, so we can lift these hands. Okay. Any type of skin breakdown. I'm also gonna check for any peripheral edema, so no edema. I'm gonna look at your skin turgor, so I'm gonna see your hand. I'm gonna pinch up, and then immediately recoils down, so it's good skin turgor. Okay, and then from here, we're gonna go ahead and take a look at your nail beds. And I see your nails. Okay, so I'm gonna compare them. Perfect, so the angle is about a 160 bilaterally. Her nail beds are pink. No, check the capillary refill on both. They turn white very quickly, less than 3 seconds, good cap refill. The nail beds are round. They look good, no signs of clubbing, no cyanosis to the skin. So everything looks pretty good as far as your head, skin, and nails, okay? Now we're gonna take a look at your neck, okay? I'm gonna start palpating here in a minute, so I'm gonna touch. Do you have any problems with your thyroid?
No.
No? Okay. So first what I'm gonna do is just look straight. I'm gonna look for her trachea. Here we go, and it's midline. I'm also going to look for your thyroid, so I'm gonna go behind you, okay? So I'll go from behind. I'm gonna feel your thyroid isthmus. Looking for thyroidmegaly. Okay, I didn't see any possible goiters. I don't feel any type of nodules, any masses. Go ahead and swallow. Okay, and I feel it going up and down. That's good. Okay, so I'm gonna look for your carotid. Okay, so I'm gonna palpate one at a time. Okay. Okay, and I'm actually gonna listen. So I didn't feel any type of thrill. So we're gonna auscultate. Good, smooth pulse. I didn't hear any breweries, and I'm actually going to listen to her thyroid as well for any breweries. I didn't hear any, so all of that is normal. Okay, and then as far as her head goes, we're going to look at the contours of her head. I don't see any type of masses, lumps, bumps, nothing whatsoever. I'm gonna look at her face, okay? Eyebrows, bilateral. Both are symmetrical, eyes symmetrical, nose, mouth. Can you smile for me? Okay. Can you show me your teeth? Can you make a bubble with your mouth? Perfect. So what that tells me is that her cranial nerve number 7 is intact. Okay, from here, I'm gonna go ahead and look, and we're gonna take this to your nose. I'm gonna use my light source. In this case, it's my otoscope. Okay, can you look up, please? Okay, so we'll take a look here. I'm gonna lift. Nasal canal is pink. No type of septal deviation. No polyps. Good. Okay, and then from here, we're gonna take a look in your mouth. Now for this, I'm gonna go ahead and put some gloves on because I'm actually going to feel inside your mouth, okay? Might feel a little weird. I apologize. Okay, can you open? Oh, let me get this. Time to pressure here. Okay, can you open your mouth and say ah? Awesome. So whenever she did that, I noticed that her uvula went up, and as did her her tongue. So that actually tested our cranial nerve. You okay? Okay, by doing that, we tested our cranial nerve number. 9, and 10. Okay, so we tested now can you stick your tongue out midline, see if you can do it straight down. Perfect, and that we're testing our cranial nerve number 12. Okay, so you can open your mouth. I'm gonna go ahead and look in again. All right, I'm gonna push your tongue down with your blade and you might feel a little gaggy, okay? Okay, so I can see your tonsils, uvula, uvula midline, everything looks good there. I inspected her outer part of her mouth, her lips. They're moist, they're pink. Put that down, open your mouth. Okay, so looking at her gums, they're good color, no lesions noted to the mucosa. Okay. Her teeth, no dental caries. Can you lift your tongue? Okay, looks good. All right, everything looks normal there. So I'm gonna go ahead and take off my gloves. I'm gonna go ahead and wash my hands again. Okay. So that was our mouth. Now, since we're right here in the face, I'm gonna go ahead and I'm gonna feel her sinuses. Okay, so these are the frontal sinuses. I want you to tell me if you feel any tenderness. Any tenderness?
No.
So they're frontal. Now we're gonna feel the maxillary sinuses. Any
No.
tenderness? No. Okay, now we're gonna go ahead and palpate the lymph nodes, see if we can feel anything. I'm just gonna move your hair back if that's okay. So we're gonna do the preauricular. Okay, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, occipital, behind the neck. These are gonna be the ones that might tickle you, okay? You can bring your arm out. There's a cochlear. Okay, and then axillary. Okay, good, you didn't even get ticklish. Okay, so I didn't feel any lymph nodes. If I were to feel any type of hard area, like a round hard area that's fixating the spot, I would be a little bit alarmed. If I felt anything pea-sized that's mobile, then that would be more of a normal finding as far as her lymph nodes. Okay, now I'm gonna go ahead and do your eyes. All right. Okay, so first I'm gonna look at the exterior eye. Okay, so lacrimal apparatus looks good, no type of exudate, no drainage on both sides. Okay, I'm gonna look at the sclera, it's white, looks good. Her pupils, her iris is nice and brown. Okay, her lens, clear. Okay, now what I'm gonna do is called the red light reflex. It's kind of uncomfortable for you because I'm gonna shine the light directly into your eyes, but I'm gonna find this little red area and I'm gonna follow it in to look inside, okay? All right, so whenever I look at her right eye, I'm gonna use my right arm. I'm not gonna use this one. I'm gonna go ahead and use the ophthalmoscope. Okay, and I have it set to 0 to start with, and I'll mess with it if it's blurry. Okay. Alright. Okay, so I can see it. I'm gonna go and hold on here because I don't want to get too close, and I will get close. Okay. Okay. Perfect. So I followed into your eye, red light reflex. I'm going to do the same to the other, and I'm going to switch. Okay. I'm going to follow it right in. Okay, everything looks good. I was able to, you okay? To see all the landmarks of the eye and everything looks good, okay? Now we're gonna do a cover and uncover test, and we're gonna check the alignment of your eyes by doing that, okay? So I'm gonna actually cover one eye, and I see that this eye is straight, fixed, looking at me. It didn't move, it didn't shake whatsoever, so I'm gonna do the same for the other. Okay, that looks good. I'm going to do the corneal light reflex, so I'm going to shine the light directly right in between, and I'm going to look to see if the lights reflect in each pupil. And they do, okay. Now next we're going to do the, we're going to check her pupils and see if they have the direct and conceptual reflexes. Okay, once again, we're gonna do the right and the right. Okay, so I'm gonna look. That pupil was able to equal, round, and constricts, and that's direct. And now we're gonna do it again. This time I'm looking at the left, and the left was able to do the same. That's the conceptual. Gonna do the same on this one. Okay, direct, it was able to equal, round, reactive to light, same. Look at the right side this time. Okay, and then it was able to constrict. So that was our perla, and from that we were able to check to see if our cranial nerves were intact. That was cranial nerve 3, 4, and 6. Okay. Now whenever we check her eyes here in the office, what we do, the first thing, well, one of the tests that we use, it's a chart, it's called a Snellen chart, and the chart would be 20 feet away from her, and she would then read for us the last line that she could, and that would check our visual acuity for farsightedness, so, or not farsightedness, for seeing far away. Another test we would use, a chart we would use, is the Rosenbaum test, and it's a card, and you would hold it 14 inches away, and it would be the same concept, but this is going to check her nearsighted vision. Okay. All right, so we did our eyes. Okay, so as far as the eyes goes, we're going to check her 6 gazes. So I'm going to get my finger here, and I want you to follow my finger, okay? The 6 field gaze, so we're going to look. And her eye is following very nicely. Now you're going to follow in. Sorry. Perfect. You did very well with that. So that's going to check her ocular muscles, and that was good. Okay, next what I'm going to do is we're going to check her ears. I'll go ahead and jot down my findings. Okay. Alright, now the first thing that I want to do is I'm going to look at the symmetry. Look at the exterior ear. Here, I'm looking, and I'm actually going to touch the pinna. Do you feel any type of soreness here on the lobe? No. And the mastoid process? No. Okay, I'm going to do the same. Everything I do to one side, I'll do to the other.
No.
No. Okay. Perfect. So I would want to check that before I actually put my otoscope in her ear, because it simply would hurt her. It would mean maybe she has an infection, an exterior infection, or infection inside. Okay. I'm going to do what's called a whisper test. So I'm going to include one side of her ear, and I'm going to whisper a word, and she's going to repeat what I said.
Apple.
Perfect. Do the same to this side.
Baseball.
Perfect. Okay. And you know what? From here, I'm going to go ahead and use my tuning fork here, and we're going to do the Weber test. Now with the Weber test, I'm going to measure lateralization of your hearing. So I'm gonna hit it, I'm gonna put it right on your forehead, and I want you to tell me which ear you hear it the most. Okay? Okay.
Both.
Both? Okay, it's perfect lateralization. Now this time we're gonna do the rhyme test, and this one we're gonna check for air conduction and bone conduction, okay? So I'm gonna hit it, I'm gonna put it right here, and I want you to tell me when the ringing stops, okay? Oh, sorry.
Now.
You still hear it?
Yeah.
Okay, so that's good. That tells me air conduction is greater. She stopped feeling it in the bone, and then when I put it next to the ear, she continued to hear it. I'm gonna do the same on the opposite.
Now.
Perfect. So that means, all right, the air conduction is greater than the bone conduction. That's good. In the hearing, we assess for her ocular nerve number 8. Now from here, what I'm gonna do is we're gonna move on to her chest. Okay, so I have my stethoscope here. Move this a little bit. Okay, I have my stethoscope here, so I'm gonna look at her chest. I'm gonna look at her breathing pattern, her symmetry of her breathing. Looks good. I don't see any abnormal rhythms or movements. I'm gonna go ahead and listen to her lungs. I'm gonna listen front and the back. Okay, whenever I put my stethoscope on, I want you to breathe in and out. Now, whenever I go over this shirt, it's gonna be skin to skin. She's not gonna remove her shirt for this assessment. Okay, deep breath in and out. Perfect. In and out. Perfect. In and out. Perfect. Oops, sorry. So we're gonna go under, right here. Thank you. Okay. I'm gonna go ahead and listen. She's gonna turn around and listen to her back. Okay. Breath sounds on her back. Good. Perfect. Perfect. Now, while she was breathing and I was talking to her, I counted her respirations, and they were at about 7. She had a nice symmetrical breathing pattern, and the sounds that I heard in her lungs were clear. I didn't hear any adventitious lung sounds. Now I'm actually going to percuss her lungs, and I'm going to start in the back. I'm going to do a lateral right under the axillary, and I'm going to do the front. Okay? Now you're just going to feel me tapping on my finger. Okay? Okay. Okay. Now go ahead and lift this on. Okay. And do the front as well. Okay. Okay. Can you lift for me? Thank you. Sorry, I know this is kind of uncomfortable. Okay, and one more right here. Okay, perfect. Okay. Alright, and now we're going to do the heart. Okay, so with the heart, I'm going to inspect her chest again, and I want to know if there's any thrusts, any pulsations that I can see. I shouldn't be able to see any of that right now, okay? Earlier when I assessed the carotid, I didn't see any as well. I'm gonna go ahead and listen to her heart sounds. And this one's gonna take a little bit longer because we're gonna do some sitting up, laying down, and standing up. And I'm also gonna differentiate between my diaphragm and the bell of my stethoscope, okay? Before we start, let me palpate the apical and the pericardium. So it's gonna be here, fib intercostal, midclavicular. It's about 70 beats per minute. Now we'll take a listen. We're gonna do the aortic, pulmonic, using the diaphragm first. This will also be skin to skin. She will not remove her shirt. Okay. Pulmonic. Herb's point. We're gonna do the tricuspid. Can you lift for me again? And then mitral. Perfect. So I'm gonna do it again using my belt. Aortic. Pulmonic. Herb's point. Tricuspid. Sorry. Mitral. Okay. Good rate and rhythm as normal S1, S2. I didn't hear any gallops or murmurs, so I'm gonna go ahead and do the same thing while she's laying down. Be listening to the same spots just as she's laying down. Use my diaphragm. Herb's point. Tricuspid. Mitral. Okay, do the same using my belt. Aortic. Pulmonic. Herb's point. Tricuspid. Mitral. Okay. Can you stand for me? We're going to do the same thing as she's standing. If you can turn. There we go. Diaphragm first. Mitral. Okay. Now use the belt. Aortic. Pulmonic. Herb's point. Tricuspid. Perfect. Okay, you can have a seat. Now, standing, laying, and sitting up, I heard no murmurs, gallops. The rate and rhythm was good. Rate and rhythm was normal. I heard normal S1, S2, so. Okay. Okay, so we're going to move on to the abdomen. Now for the abdomen, if I can get you to lie down. Okay, I'm gonna lift your shirt. Okay. Now, before we started our assessment, she let me know in her history that she just had a baby at 4 months. So we can see the striate here. I'm gonna check the contours of her abdomen. I'm gonna check to see if there's any irregular motions, if I can visualize any masses, if I can see any pulsations, and I can't. So now I'm gonna go ahead and listen to your bowel sounds, okay? I'm gonna look using my diaphragm, my stethoscope. So this will be the right upper quadrant, okay? Left upper quadrant, left lower quadrant, right lower quadrant. Okay, she has active bowel sounds. Next, I'm gonna do a little bit of percussion on her abdomen. I'm gonna start with the quadrants of her abdomen. I'm gonna go to the gastric bubble, or the epigastric area. Okay, nice tympanic sound. Perfect. Now I'm gonna go ahead and assess, I'm gonna percuss her liver, okay? Now with the liver, it's gonna be on her right side. I'm gonna kind of get up here. It's gonna be on her right side, and the way I'm gonna distinguish it from her stomach is I'm gonna hear from a tympanic sound to a dull sound. So I'm gonna move up that way. Tympanic. Okay, and then a dull sound. Same thing on the left. This actually is gonna be her spleen. Now with her spleen, we're gonna find the 10th intercostal rib. The last rib is the 12th, so I'm gonna kind of move up to the 10. I'm gonna go ahead and put a dull feeling, okay? If she were to take a deep breath, so where I heard dull, take a deep breath, it would turn tympanic because it would actually move up whenever she breathes, okay? That looks good. I'm gonna do a little bit of light palpation. I'm gonna feel for any masses. I don't feel any type of irregularities. It tickles her. I guess it's too light. And then I'm gonna go ahead and do deep palpation. So you let me know if you have some tenderness whenever I touch. I don't feel any type of masses, any type of irregular. It's a nice soft abdomen, and I'm tickling her. Okay. Alright, so abdomen is good. If you want to go ahead and sit up, we're going to move on to your musculoskeletal system. Okay, the first thing that I want to do is we're going to check your cervical spine. Okay, so we're going to do some range of motion. Okay, so I want you to, you're going to go down, chin to chest, middle, up, okay, side, side, middle. Now we're going to do passive and active. So now I want you to push my hand and try and get your hand to your head to your ear. Perfect. This way. Perfect. Okay. And we're gonna do your elbows. So can you elbows out? Okay. In, out. Perfect. Now I want you to pull me with them. Try and bring. Perfect. Okay. Now we're gonna do your wrists. Can you put your hands out? Flip, flip. Good. Up, down. Okay. Up, push down. Perfect. Okay. Now I want to see your fingers. Okay. Open, close, open, flip. Okay, do this, just your fingers. Okay, now I want you to pull me up with your fingers. Okay, good. Now from there, we're going to do your hips, okay? And can you lay down for me? All right, now with your legs, can you put them straight out? And then I want you to open, okay? Close. Now open with my resistance, okay? Close. Perfect. Okay, I'm gonna pick up, I'm just gonna check the range of motion. Up, out. Perfect. Any pain? Out. Perfect. And since I have you right here with your feet, can you lift your feet up? And push down on my hands. Okay, and pull up. Perfect. Okay, can you sit up right here? We're gonna check your knees. Okay, can you bend your knees back? Okay, forward. It popped a little bit. Okay, you okay? Now, pull them back. Okay, push them up. Perfect. Okay, a good range of motion. Your knees. Now, if I can get you to stand, please. I want to check your gait and your posture. So she stood up very easily. She had no difficulty. Can you walk back and forth? Perfect. Now what I want you to do is stand, which is called the Romberg test. I want you to put your hands out, palms up. Okay, close your eyes. Perfect. Now you can see she's not swaying, she's not falling over, so she has, okay, thank you. Perfect. Okay, now I want to check for scoliosis. So what I want you to do is bend over to touch your toes. So I'm going to look at the curvature of her back. It's nice and straight. Everything's symmetrical, shoulders, scapula, even the hips. Okay, so no signs of scoliosis. Okay, thank you. Okay, if you want to have a seat. Okay, so next we're going to do a little bit of neuro findings. We're going to do soft touch first because we're going to assess our cranial nerve number 5. Now, I have this, and it's not going to hurt you. This is going to be the sharp, so I'm going to touch you with it. That way you know what's coming. And this will be the soft. Okay, it's clean. I just took it out, okay? I'm going to tap on you, and you tell me yes if you feel it, okay? All right, so I'm going to start with the forehead and soft.
Yes, 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 yes.
Perfect.
Yes, 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 yes.
Perfect. I'm actually going to do the same for the rest of her body to check sensory. Okay.
Yes, 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 yes.
Okay. Same sharp.
Yes, 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 yes.
You know, while you're here, I'm going to go ahead and do your pulses. We didn't do that earlier, so let's go ahead and do that. So we're going to feel your tempo. Brachial. Radial. Okay. We're going to do your feet. Can you stretch out your little feet for me? Popular. Sorry. Dorsalis pedis. Posterior tibial. Perfect. Okay, now what we're going to do is test your reflexes. Okay, so we're going to do the radial. brachial. So we're gonna do, here's your thumb, here's this tendon. Okay, and we saw that reflex. Good. Same on the other side. Good. Okay, we're gonna do the brachial. Good. Good. Okay, we're going to do the the tricep. Okay, patellar. Well, for this one, I'm gonna move a chair because she's a little bit close to the ground. You got it? Oh. Okay. Okay. Yeah, I'm gonna actually lift these for you, okay? Okay. Okay. Perfect. Okay, for this, can I get you to stand, move the chair? Okay, can you just put your knees on there and look that way? Okay, we're gonna do the Achilles. I'm sorry, are you okay?
Mhm.
Okay. Okay. And we're actually gonna do the Babinski reflex to check the plantar. Okay, and her toes in. Okay. All right, perfect. Okay. Trying to see if there's anything that we've missed today. Okay, we're gonna do, let me see. Okay, and we're gonna do the nose to finger. So finger here. I want you to touch your nose. Now touch my finger. Touch nose, my finger, nose, finger, nose, finger, nose, finger. Again. Perfect. Now we're gonna do the rhythmic repetitive movements. Okay. So what I want you to do is you're going to flap your thighs, up, flip, slap that way. Many times as you can. Perfect. All right, the rhythmic repetitive movements. Okay. And that will end our physical assessment for today. Do you have any questions?
No.
No? Okay.